Welcome to Beyond the Balance Sheet, the podcast that helps advisors, clinical professionals, and affluent families understand the complexities of issues related to our mental, physical, and emotional well-being. Our co-hosts, Arden O'Connor and Diana Clark, will interview a series of guests on a range of topics, providing informative content and practical tools for professionals and families to consider. Here are your hosts, Arden and Diana.
Hi, everyone. Welcome back to another episode of Beyond the Balance Sheet podcast. Welcome, Dr. Biswas. We're really excited to have you here today.
Thank you very much.
Well, we were lucky enough to speak on a great panel related to white-collar crime, and I'm excited for our audience today to hear about your focus areas of practice, to hear a little bit about forensic psychiatry and how mental illness and criminal behavior intersect with both people from basically all different walks of life. I thought I'd start out by giving our listeners and our watchers a little bit of your background. And I'm going to read it because it's incredibly impressive and I'll inevitably mess up one of the credentials. Dr. Biswas is an instructor in psychiatry at Harvard Medical School and a board-certified adult and forensic psychiatrist. She is the director of psychiatry law and psychiatry program Psychiatry Law and Society Program, that's a mouthful, at Brigham and Women's Hospital in Boston, and the co-director of the Harvard Mass General Brigham Forensic Psychiatry Fellowship. She's a clinician and a researcher on psycho-legal issues, acute psychiatric care, and physician well-being, and she was awarded the Massachusetts Psychiatric Society Award for Outstanding Psychiatrist in Early Career in 2023 for her contributions to these areas. Her research is focused on improving mental health laws so they can better serve patients and their families and caregivers. What an important area to be focused on these days.
I agree, Arden. It's just, the situation is overwhelming. And at this time, I really hope we can do some education around, what is mental illness? How do we help people with it? How do we help ourselves?
I think that's great. Well, let's start out by just the basics. Talk to me about what forensic psychiatry actually is, what the role is, why it's important for folks to know about.
Sure, and absolutely. That's a great question. It sounds sort of basic, but I don't think a lot of people know what forensic psychiatry is. And it's actually different from forensic psychology, though there are a lot of overlaps. I will speak to forensic psychiatry because my training is in psychiatry and the law. So first of all, just the basic overlay. It's a subspecialty of psychiatric medicine where it intersects with the law. And so what is psychiatry? So psychiatrists go through medical school. They end up training in a residency program at a hospital, training in the subspecialty of psychiatry, which is the medicine of mood, behavior, and disorders of mood and behavior. And so after you do a psychiatric training, you can also do a subspecialty training in what we call forensics or psychiatry in the law. That field began because there were so many intersections around people with mental illness and their interactions with the law. Because in the law, you require actus reus, which is the act itself, in criminal law, and mens rea, which is the intention. The mens rea piece became something that the courts really needed expertise around to help understand in order to be able to sentence, to convict, to come up with verdicts. They require mens rea. And so psychiatrists and neurologists often get involved in that space. How do I think about forensic psychiatry? I actually take it a step further. I think about it as consultation to social organizations around mental health expertise. And so what ends up happening is we not only liaison with the legal system, but we liaison with courts, correctional systems, the legislative system, organizations that require evaluations of an individual, colleges, schools. Lots of social institutions require some type of consultation around what's actually going on with an individual that they're trying to help. And so that is where I think forensic psychiatry is going beyond just working on criminal law.
So interesting. There are so many questions that I have, but I'm going to start off with one that I think many of our listeners might relate to, which is, we hear about cases, all sorts of criminal cases, and you hear about, the various plea deals that people try to work out due to questions of mental capacity. And I'm thinking specifically in the corporate setting. Can you explain, or can you give us your view on how the complexity of mental illness can lead or impact, criminal behavior in corporate settings? And I'm thinking about some of the CEOs and some of the finance companies that have had so many struggles recently with people making what seem to be very clearly unethical decisions, and how mental illness may play into that or not play into it.
Right. And so we think a lot about criminal behavior, wherever it lands. I think there's one category of violent behavior, which is maybe more my area of expertise, but also other types of behavior that are criminal, that hurt others in different ways. Basically lands around impaired judgment and oftentimes also impulsivity. So I would say that those two things really do end up coming in, playing a role when mental illness is also involved. Ways I think about how people in the corporate setting are also, vulnerable to these issues is that, we see a lot of people with mental illness also have a history of trauma. Right. And so trauma early in life, throughout life, whether it's in the corporate culture, but early in childhood as well, result in maladaptive coping skills and maladaptive behaviors. And so there's just this complex interplay between all of these things that results in criminal behavior. And it often ends up that a forensic psychiatrist gets involved to suss out all of the various aspects that may lead to the propensity to the behavior that happened in that individual's life. So often, big pieces that play a role in what I see when I do these evaluations is substance use and traumatic brain injury and mood disorders. So those often play a big role. All three of them, or one or two of them can play a big role in impulsive behaviors and impaired judgment. And so how do we see that play out? Trauma. So if you have a history of very difficult circumstances, and trauma now is defined in so many different ways, and we're really thinking about trauma from a micro to a macro level, but really let's talk about serious types of abuse, sexual, emotional, physical, and neglect and divorce and conflict and aspects like that play a huge role in people's lives that lead to maladaptive coping skills in order to get to the place that they are in life, result in suppressing a lot of just negative feelings that people don't want to deal with. Okay, so there's the trauma piece that can lead to impaired judgment. But then also on top of that, there is the self-medication of pressure and trauma in people's lives that can also lead to impaired judgment, impulsivity, and bad decision-making. So there's the substance use piece. And the other piece that we don't talk about a lot, but we see a lot in mood disorders is traumatic brain injury. A lot of times people with mental illness and mood disorders will end up in precarious, vulnerable situations that do end up leading to traumatic brain injury. And traumatic brain injury can look invisible to the outside world, but yes, plays a huge role in how people live their lives and make decisions. And I've often seen a very interconnected like, those are comorbidities, I think, that result in violent behavior, impulsive behavior, and bad decision making.
It's really interesting that you mentioned that. My brother had actually a TBI due to a ski accident. And to your point, it was invisible to most people. If you met him, you wouldn't have known it. What they claim in terms of the workup he got that it impacted was his impulsivity, which already was, he already had sort of low impulsive controls, or however you say it. He was a very impulsive person, and he had a predisposition towards substance use. But this TBI, they claim, kind of lowered his inhibitions even further. And we saw that play out over the course of his treatment. I guess one question might be, because what's interesting is, while we had all access to this clinical information and we reviewed it with a psychiatrist and we were able to put him into a program that hopefully addressed some of these issues, to the average person, I'm thinking about on a jury, he appeared completely functional. If anything, he looked like a child that grew up in a wealthy family that was acting out, bratty, whatever, entitled, whatever term you want to use. So, and maybe you can't answer this, maybe it's an impossible question, but how do you think about, when you think about going in and testifying on behalf of folks that have experienced this, is there a line of culpability? How do you think about whether this person is going to be bettered by intensive treatment versus, sort of somebody where the line is around what they need to be held accountable for?
Oh my gosh, that is such a complex question, but also so important, and exactly what I do, what my colleagues do, what we do in the clinical setting as well. I mean, because ultimately what you're saying is this treatable? Is the person accountable? But also, do we need to look at all the factors that are playing into it so that we can treat it so it doesn't happen again, or this person is helped in some way, right? So we reduce the recidivism, or kind of the constant nature of moving through the psychiatric system and the criminal justice system. And so, such a good question. And I think in a lot of ways, that's what the structured clinical interview does. We look at all of those components when we're doing that evaluation to see, like, what made up this person's mind in its current state that resulted in the behaviors that we're seeing. Now, our job as the forensic psychiatrist is not to make the ultimate decision of accountability, right? And our job is ultimately to give a clinical opinion of what caused the behavior from what we know clinically in that evaluee interaction, and how can we help that situation? So oftentimes my recommendations never include, and by the way, he should go to jail for 7 years, or she should go to jail for 7 years. My recommendations are always like, here's the treatment that's going to be necessary to address the trauma, the substance use, the TBI, the mood disorder, and whatever else is kind of resulting in it. So really, how I think about this is I get a social history, a psychiatric history, a medical history, a trauma history, a legal history, a violence history, a history of work history as well. And I kind of look at all of those different components and how they interplay to make the person who she or he is. And then I talk about what was disordered in that situation, in the clinical opinion, and then give recommendations of how we can target it. So this is why figuring out trauma is so important, or substance use is so important, because ultimately, while the person may still be accountable, when you describe the person's story, it humanizes the individual into this is who this person was, and this is what kind of landed this person here. How do we help them so it doesn't happen again? How do we help them so that this is as rehabilitative as it is punitive? Like, at the end of the day, we're all human and we come from different backgrounds. And how do we create moments of recovery in that space after the evaluation is done? And I don't know if that answers your question, but it does. I think it does help with accountability as well when you humanize that individual and make treatment recommendations.
It absolutely does. And I think it gives people a broader picture. I mean, I think one of the things we see in our practice is so much concern, because of school shootings and violence that just exists in our country, when people have a mental illness, I think there's a bit of a misperception that necessarily means that the person is going to be vulnerable to acting out at any moment. And I think giving context around what led somebody into the decision making gives, whether it's the jurors there, or whether it's their family, whether it's just the general public, an understanding of the context, the contextual circumstances that led to the behavior. So it's not at any moment this person could come out and do X, Y, Z. It's contextualized based on that person's background. I think one other question I have is, and I'm curious if, not just you, but your colleagues, are there certain diagnoses or historical factors that in your mind make a case more hopeful that the treatment will be impactful? And I ask this because we deal with folks with a range of disorders, from thought disorders to mood disorders. Some are more treatable by medication. Some require more adherence to a pretty regimented therapeutic program, and lack of insight into diagnosis for a lot of clients is an issue. So I'm curious how that maybe it doesn't impact your recommendations or your testimony. Just as a psychiatrist, you sort of look at some cases and think, wow, even if they get the treatment, this is going to be a hard protocol for this particular person to adhere to based on either their history and or their diagnosis.
It is. Oh, that's such a good question, and so important. And it is case by case, because it really depends on the individual and how they're gaining insight. I do think one of the major blocks to intervention is lack of insight. If you can't see it yourself, nobody can see it for you, right? So nobody can see it for you and give treatment recommendations and have you voluntarily gain benefit from those interventions if you don't see it yourself. And that lack of insight, in my work, I've worked with a lot of people with serious mental illness, and so I see it in psychotic illness and manic illness more often. But we certainly also can see it in very intransigent or refractory personality disorders, where there is so much suppressed and so much in denial in someone's history, their own psychiatric history or medical history or their just life history, that it's very hard for them to access what happened because it's so painful. And this is why trauma plays a big role also in insight. And what happens is, if that trauma starts to bubble up, people will use, in this particular population, often they'll self-medicate and use maladaptive coping skills. And so substance use, we know, when used to self-medicate and suppress really difficult feelings, can result in a whole host of very serious, irrational, unpredictable, impulsive behaviors, right? So we know, like, anyone who is overusing alcohol, overusing cocaine, overusing stimulants, overusing opiates, can really have bad repercussions and result in interactions with the law. So this is what, it's just sort of, it can be a self-fulfilling prophecy, and it can be a downward spiral depending on that person and their ability to have insight into, like, what's actually going on. Because as soon as you develop some insight, you can engage in the treatment, right? Like, and that is important. So I often find in mood disorders or psychotic disorders, if you can get people on the right treatment and it's working for them, that impaired insight starts state, and then they're more engaged. The problem is that engagement and that impaired insight can wax and wane over time, and then you end up kind of with these future cycles of lack of awareness. But I do find in mood disorders are treatable, psychotic disorders are treatable. That's what I want to give hope around. Traumatic brain injuries are treatable. We see a lot of post-concussive syndromes that, like, over time improve, slowly, unfortunately, but they do improve. And with the right types of interventions and rest and recovery and treatment, people can improve from post-concussive syndromes and completely regain their potential. The other thing is, I've also seen that these concussive syndromes can go hand in hand with mood disorders. It ends up resulting in depression and PTSD from however the head injury occurred. And so treating the mood disorder along with the concussive disorder can also be really helpful, to recognize that all of those processes are happening at the same time can be really valuable to treatment and seeing future improvement.
I think it's great. I love to hear the message of hope. And I often say to families who are so devastated that their loved one has a substance use disorder, as an example, one benefit is if you're able to get them into the right treatment and they're able to remain abstinent, you are going to get back the person you remembered. It may not be exactly with the same behaviors as they had as a child, but you can see these traumatic turnarounds. And really, it's just trying to use whatever, in my opinion, whatever motivators there are. I was going to use the word leverage, but it sounds very punitive. But sometimes, honestly, the criminal justice system can be the sign, or it can be the motivator for somebody who's not been able to get clean or engage in therapy in a regular basis. Sometimes knowing that they're pending charges, and this might be a way to appease the court and avoid a more lengthy jail term, or have treatment be part of your aftercare plan, or however it's positioned. Sometimes that is the motivator folks need.
That rock bottom moment of kind of ending up in the penal system, I have often seen those are these moments where people finally have a moment and space to rest and actually just not have these outside forces cause pressure, where they can reflect. And that reflection can be really helpful in engaging in treatment and regaining insight and actually just like looking at your life. So you bring up a great point around that. Not that nobody wants to get to that point and nobody wants to be there, but if it does happen, if we can turn that experience into something positive and really help people gain insight, I've just seen a lot of turnarounds in that space.
Totally agree. We have a client who actually has had a loved one who's been incarcerated before, and that's the one time that they've been able to get her to agree to medication when she's incarcerated. And that gets her clearer headed in terms of her thinking, which allows her to engage in clinical treatment. And it doesn't always last, but it often can be. I never thought I would see this, but oftentimes when she's in jail, it's the best time for this family because they feel like they know she's safe, she's getting some clinical treatment, and she's stable.
Yes. And that is the sad, I have seen that too. A lot, where families are getting some respite and ability to recover from not being able to get their loved ones the treatment that they need and deserve and should have. And I think it's in those moments where they can kind of coalesce resources and figure out the best way to move forward. It's like a pause in a way to be like, all right, we're rock bottom, we're in a pause, and maybe we can regroup and figure out a new direction. And it's unfortunate that it has to land there. Can't there be a better way than landing in the criminal justice system? But I have seen that is sometimes the space where things really turn around.
Absolutely. Can you talk a little bit about the differences you see either in the incidence of mental illness or the manifestation in forensic psychiatry between folks from different socioeconomic groups? So either higher net worth individuals versus folks who come from more impoverished situations. Is there a way that plays out? I can predict how it might play out, but I'm curious how you've seen it play out either in the types of crimes that are committed or the way families are able to access resources or incidence rates of particular diagnoses.
I think this is where just sort of my biological training and background in mental illness comes into play. And what I really think, whether you're high net worth or low net worth, biological mental illness knows no bounds, and it doesn't have kind of a financial boundary. So I certainly see biological serious mental illness kind of, not see financial boundaries as in any way. So, I mean, low net worth or high net worth, you're still vulnerable to mental illness. And I think that that's an important thing to recognize. There is a lot of literature, though, that, people in cycles of poverty and in social disorganized situations in early childhood certainly increase the propensity for having mental illness, substance use disorders, and TBI because of just there isn't that buffer of good healthcare systems and good school systems and good nutrition and all of those things. But that doesn't mean that people of high net worth don't end up in very socially disorganized and high pressured settings, in high conflict settings, in abusive and neglectful settings as well. And so I've certainly seen it play out across the population. But what I do see that sometimes in the criminal justice system, people of high net worth do end up falling through the cracks because maybe, in trying to get treatment, the families are using money to figure that out. And people in impoverished situations sometimes have that safety net of being indigent and getting public defense and having those things in place earlier. So sometimes I do see the opposite occurring in terms of people getting the help that they need. But ultimately, serious mental illness and traumatic brain injury doesn't nod to net worth. And I think we need to think about each case individually and really make sure we do a thorough evaluation, no matter who that individual is, for getting the right treatment interventions in place.
I think it's a great point. And I think I shared with you when I met you that I ran a home for foster care kids who were, largely 15 to 22-year-old men in the Medicaid system. So extreme poverty, abuse and neglect, criminal behavior, multiple comorbidities in terms of substance use and mental illness. And I learned very quickly how we were going to have to interact with the court system in order to advocate appropriately, to keep them in less. Right. What my goal was to keep them in the group home that I ran, even if they violated probation with something as simple as testing positive for marijuana. Fast forward 10 years, and my brother, who comes from a high net worth family, who has gone to private school and had all the advantages, I used very much the same skill set I used with the foster care kids. And I learned it from being in that system. I remember talking to his attorney and saying, well, we can't send him back to the 8th rehab now. We have to look at a brain injury program because the court will look at that as something different than what he's been to previously. And again, all of that, and even how we detailed his timeline and the way he was going to be monitored, it was all based on my experience with a very different population. I'm not sure, had I not worked with these foster care kids, if I would have known that strategy. And I'm not even sure our attorney would have known it, to be honest, because I think, he's concerned with the law. But I'm not sure, he asked me, can you go find the right program? And I used some connections that I had professionally to be able to navigate that. But again, had I not had that model, I'm just not sure we would have seen the outcome, which was that he was able to avoid a 5 to 8 year prison sentence in California. That's what my brother was, that was what was sort of out on the table. So,
yes.
Absolutely. Absolutely. Well, I'm thinking, I love to hear stories. And I'm thinking one way we could end the podcast today is by you telling either a story or two about ways that you think your testimony has helped somebody get the care that they need.
Sure. It happens all the time, where when you get on the stand as a psychiatrist and describe the person's history and talk about who they are and talk about their struggles and say, look, these are the interventions this person needs in order to overcome what just happened. I've seen the courts take compassionate stances on that over and over again. And I think that we as a society are evolving in that way. We're moving towards a higher consciousness of understanding that being violent is not a normal way to be as a human being, right? Like, it's being caused by something. And what is that something? And can we intervene there to make this rehabilitative as much as anything else when someone is involved in the criminal justice system? And so I can think of a case recently this spring where this was unfortunately a murder charge, and this individual had a long history of abuse, but and at a very early age started using substances because his family was using substances. He was exposed to that at a very early age. And as we know, if you're using substances like cocaine and opiates at a very early age, it changes the brain very seriously and can result in higher levels of mental illness later in life. And this individual, when clean and sober, was, a true model citizen, was working in a very high-tech job as an engineer, a really brilliant, smart person. In this individual's spare time, he was creating a homeless clinic and giving food and resources to people with substance use disorders because he had such compassion for those individuals with addiction, because he understood it so well. But then when he would fall into his own binge, it would be incredibly difficult to get out. And so this individual ended up very sick in a homeless encampment, and when on a cocaine binge, became very paranoid, and in self, finding things a threat during that period of time, ended up in a tussle that resulted in the other person dying. And my role was to really spend time with this individual and understand what happened, and talk to him over time and really understand his own understanding of addiction, how painful the struggle is, how he wanted to just die, which is why he ended up in the homeless encampment, because he just couldn't figure out a way to get out of his circumstance and out of his addiction problems. And being able to explain that to the court, and being able to explain what a cocaine binge looks like over time and how that changes the brain, and how you do have paranoia and hallucinations and believe everything is threatening and start to have these delusions that you may act out in those ways. And so this individual ended up with a much lesser sentence because of that testimony. And so I do see it, but I don't see it as I'm speaking to that to reduce the sentence. But what I am seeing it is like, we need for this individual to get the addiction treatment this person needs so that they can be the real beautiful human being that they are when they're sober. Right. And to be able to explain that to the court and how the brain changes on drugs.
Absolutely. And we're also in that process, you're also protecting the public and making sure that nobody else's life is hurt. So I think that's beautiful. I think it's a great way to end. Thank you so much, Dr. Biswas, for coming on Beyond the Balance Sheet today. Thank you to all our listeners and the folks that are watching. Please tune in to another episode. And if you're so inclined, please go on your podcast platform of choice and give us a great review. Have a great day.
Thank you for listening to Beyond the Balance Sheet, a podcast designed to help advisors, clinical professionals, and affluent families solve some of their biggest medical, psychiatric, and emotional challenges. Visit beyondthebalancesheet.com to read more about our guests and resources, and sign up for our newsletter.